Hello. So this research study that we chose to examine looked at the non-medical use of prescription drugs, or NMUPD, among adolescents, which is a growing problem here in the United States. Adolescents who abuse prescription drugs, mainly of the opioid family, start using when they are preteens. Not many studies focus specifically on non-medical use of prescription drugs, which sets this study apart from the rest. The researchers in this study made two hypotheses to test with their data. Number one was to explore themes related to the benefits and practices of prescription medication misuse and the roles of diverse social and cultural factors on adolescent NMUPD. Number two was to describe new and potentially influential factors of NMUPD not yet identified in previous quantitative studies, using a grounded theory approach. So the study involved 20 diverse 13 to 17-year-olds who were patients in an adolescent psychiatric inpatient unit. The participants were from the northeastern United States and had frequent prior exposure to prescription medication. Between the 20 adolescents, 12 were female and 8 were male, one male identifying as transgender. The diversity of the adolescents ranges from 11 who identified as white, 7 who identified as Hispanic, 1 who identified as Black, and 1 who identified as Arabic. The adolescents in the sample first completed a routine intake assessment packet in order to gain greater insight about their backgrounds and experiences. This is a qualitative study, so the format the researchers chose to conduct their research with was with interviews. So the researchers developed a 60 to 90-minute interview, which was created specifically for this particular study. Many different questions were asked to the adolescents to assess their personal beliefs about NMUPD and their own personal experiences. The interviews were conducted in a hospital setting and were supervised by a licensed clinical psychologist. The adolescents were also awarded a $20 gift card for their participation in the study and willingness to share their experiences. After the interviews were completed, the data was analyzed using grounded theory approach. So this is an analysis designed specifically for qualitative data in order to reveal patterns and themes in lived experiences collected in interviews. The data was also analyzed at a micro level and a macro level to examine all areas of influence. So one of the main findings in this study was that the role of mental health in adolescents' life either encouraged or discouraged the appeal of prescription drugs. For example, someone mentioned in an interview that their grandfather was addicted to painkillers, and he became increasingly depressed, which frightened the adolescent, discouraging them from messing with the prescription drugs. In many communities, there's also a stigma around mental health, and some adolescents mentioned that when it comes to mental health, they are encouraged to deal with it on their own, which could make someone more vulnerable to misuse prescriptions. Also, it was mentioned that misusing prescriptions was encouraged by parents in the cases of mental illness as a believed treatment method. 16 out of 20 participants stated that they gained knowledge on NMUPD through experience, many sharing that there are perceived benefits of abusing prescriptions. One of the biggest influencers researchers found was family history. If a parent was misusing prescriptions, teens reported feeling more pressure to misuse themselves. Also, if a teen's friends were misusing, it was more likely for them to misuse as well, for fear of being ostracized by the group. One of the main points the results found that parents and health professionals are more concerned with educating on the misuse of alcohol and other substances besides prescriptions. Right now, there is no open dialogue about the dangers of NMUPD, which means adolescents gain information strictly from the things they experience. TV and music also misrepresent the misuse of prescriptions, glamorizing their effects, which subtly encourage the behavior. The adolescents in this study concluded that their experimentation with prescriptions stemmed from the influence of their friends groups, family, and perceived positive effects shown throughout the media. The only main limitation of this study was because of its qualitative nature, the sample size was extremely small, which could lead to problems with generalizability. And since this was the first study of its kind, more studies, both quantitative and qualitative, will need to be conducted in order to discover the major implications of non-medical use of prescription drugs. And that's all. That was our study.